In the previous video, we talked about how to diagnose the thoracic spine using palpatory findings of the transverse process. In this video, we're going to talk about how to diagnose the thoracic spine using the Facet model. In real life, there's really no difference to use either the Facet model or the transverse process model. There's no difference. In real life, it's really just up to what you feel more comfortable with, using the transverse process or using the facets. But on an exam, you're still going to be held accountable for knowing what each finding means for both models. So we're going to go through the Facet model here. So the first thing that you need to understand is where the facets are. So the facets are bony articulations between each level of the vertebra. So if you have vertebra number 1 and vertebra number 2, where they touch is where the facets are, and that's how they move on one another. If you're making the palpation, they're located between the spinous process and the transverse process. So if you're going to draw this out, it's going to look something like this, where this is the transverse process, spinous process in the middle. The facets are going to be located right here. So when you're doing your palpation, you can palpate the spinous process, move up a little and horizontal, and you're now at the facets. So the next thing that you need to know is how the facets are oriented to one another. It changes depending on what level of the spine you're at. So if you are in the cervical spine, the facets are oriented backwards, upwards, and medial. This orientation tells you a little bit of how the motion at each joint will work. When you move down to the thoracic, the facets are oriented backwards, upwards, and lateral. And when you move down to the lumbar spine, the facets are oriented backward and medial. So bum, bull, BM. Easy way to remember it, bumblebee. Bum, bull, B, M. Bumblebee. On an exam, they can ask you something as simple as, which way are the facets oriented in thoracic spine? The answer would be backwards, upwards, lateral. So how do I make the diagnosis using the facets? So if I'm palpating the facets in neutral, there's no extra movement. When I ask the patient to go into flexion, two things are going to happen. The facets will open, and your thumbs will move cephalad. Cephalad just means toward the head, so they move upward. So if you draw this out, it's going to look something like this. The space between the facets will open and get larger, and your thumbs will move cephalad, or towards the head. During extension, it's going to be backwards. When you're palpating during extension, the facets will close, and your thumbs will move caudad. Caudad is a fancy way to say down or towards the feet. My teacher, when I was in school, he had a really southern accent, and when he said caudad, it sounded like he was saying crawdad. So if you think of crawdad and the legs, caudad, legs, down. So if you're going to draw this out, during extension, the joint space is going to get squished closed, and your thumbs will move downward. Squish closed, thumbs down during extension. So how do you use these findings to tell you what the diagnosis is? So what you're going to do is palpate during neutral, during flexion, and during extension, just like you did when you were using the transverse process. For the dysfunction, one of the facets may not open or close correctly, and that's going to tell you everything that you need to know. So if I'm going to draw this as a picture, let's say that we ask the patient to flex forward. On the right side, the facet opens normally and my thumb goes upward towards the head. But on the left side, my thumbs stay exactly the same. They stay where they were. This tells you that the left facet is dysfunctional and it's causing a left side bending and rotation. So if you pretend that my thumb and pinky are the transverse processes, it is now going to the left. So side bend and rotated to the left. This is your findings during flexion. Now during extension, it's going to be a little backwards. So you ask the patient to extend back. On the left side, the joint space squishes closed and your thumb still goes down towards the feet like normal. But on the right side, nothing happens. Your thumb doesn't move properly. This tells you that the right side is dysfunctional. So the vertebral segments look the same during flexion and extension dysfunctions, but you have to understand that on the left side is a dysfunction for a flexed, and on the right side, that's a dysfunctional facet for an extended. So let's do some practice questions over it. So let's say you're taking an exam and it tells you that during flexion, both thumbs move cephalad. And during extension, the right thumb goes down towards the feet, but the left thumb stays immobile. So what's the dysfunction? The way that I like to do it is I draw this out. So during flexion, both thumbs move into cephalad. So it will look something like this. Both facets open normally like they should. During extension, the right thumb moves downward towards the feet, and the left thumb stays immobile. So the right facet squishes closed like it should, but the left facet stays open. This is telling you that the left facet is dysfunctional during extension. So if you're using this to make the diagnosis, let's say that we're at T6, everything gets better during flexion. Remember, you always name a dysfunction by what it can do. So better in flexion means that it's a flex dysfunction. And if you look at our facet picture, you can tell that it is now rotated and side bent to the right because of the facet orientation. So you can put down that you are rotated right and side bent to the right. You can even use Fryet's laws to double check yourself if you need to. You know that since it's a flex dysfunction and using the second law, rotation and side bending occur in the same direction. So rotated right, side bent right. So for number 2, let's say that in flexion, the right thumb moves upward like it normally should, but the left side stays immobile. And during extension, both thumbs move down normally. So what's the diagnosis? So we're going to do what we just did. We're going to draw it out. So during extension, we know that both thumbs move normally. So both facet spaces get squished closed, and your thumbs move down normally. So now we're going to draw during flexion. So the right thumb moves upward as it normally should, but the left side stays closed, which is dysfunctional. Because of this dysfunctional facet, you can now see that the vertebral body is rotated and side bent to the left. It's really important to draw these out as you're going so you don't get tripped up by which facet is dysfunctional and which one isn't, and which thumb moves whatever way and which thumb goes where. If you draw it out, it makes it extremely easy so that you can get the points correct on the test. So draw it out every time. Use your hand model if you need to. This facet's dysfunctional, this one's normal. Your thumb and pinky move this way, so it's side bent and rotated to the left. So to write out the dysfunction, we're going to put T6. It gets better during extension, so it's an extended dysfunction. It's going to be rotated to the left and side bent to the left. So left thumb is immobile, and your right thumb goes upward. So now the third example. So they can tell you which directions your thumb moves, but they can also tell you which facets open and close. So you need to be able to interpret that as well. So let's say that during flexion, both facets open normally. But during extension, the right facet closes, but the left facet stays immobile. So we're going to stick with the theme of drawing it to make sure that we get the question correct. So during flexion, both facets open normally. When we look at extension, the right facet squishes closed, but the left facet does not close normally. So the dysfunctional segment is on the left, but you're still rotated and side bent to the right. So very important just to draw this out every time. So for our diagnosis, we're going to say T6 again. Everything is normally moving in flexion, so it's a flexed dysfunction. And during our picture, we saw that we are rotated and side bent to the right. So FRS, right. So right closes normally, the left is immobile, and both facets open during flexion. So in this lecture, we went over where exactly the facets are, how they move during flexion and extension, the orientation of the cervical, thoracic, and lumbar spine. Just remember bumblebee, M. And then 3 practice questions to go over how to make the correct diagnosis. And that's how you use the facet model to diagnose the thoracic spine.